Hello, everyone. And now I'm very happy to present Dr. Alina Piccinni, a physiotherapy for pelvic dysfunction. Hello.
Hi, Lisa, everybody. Thank you for inviting me.
Hi, Alina.
Hi.
Pelvic medicine is rapidly evolving beyond the traditional concepts of rehabilitation, focused exclusively on muscular dysfunction. Today, chronic pelvic symptoms require broader clinical interpretation involving inflammation, pain modulation, tissue quality, neuromotor balance, and functional recovery. In this evolving landscape, innovative approaches such as QMR, quantum molecular resonance, are opening new perspective in integrated pelvic therapy and regenerative functional medicine. To explore this topic, we are pleased to welcome Dr. Alina Piccinni.
Hi.
And so, how much has the clinical vision of the pelvic patient changed in these recent years? Are we still treating isolated symptoms, or should we begin to consider the pelvic patient as part of a much more complex functional ecosystem?
Good afternoon, Elisa, and thank you for having me. When I was studying, pelvic floor was absent from the books and from the manuals of physical therapists. So this ended like as a lack of awareness in both clinicians and patients. This, together with the stigma, of course, caused a lack of information. But now everything has changed because people is more aware of their body, and they consider the body as a wall connection of things. So also pelvic floor is seen as a key functional system, so it's the core of the body.
Finally. In your clinical experience, how relevant is chronic inflammation in patients presenting with persistent pelvic pain, recurrent cystitis, hypertonicity, and functional pelvic disorders?
These patients are inflamed patients. Sometimes in pelvic medicine, we treat patients as they are chasing their old tails. So it means that inflammation, augmented pelvic tone, and friction and pain, it's causing, let's say, a cycle. So if we work on inflammation, we stop this cycle, and we finally get to a point which is better for the patient.
Okay, what about the quality of the tissue?
In which sense?
In the pelvic dysfunction, you are talking about modern medicine, now is talking about quality.
Sorry. Tissue quality assessment is fundamental. Clinicians, in fact, must observe and also refer patients when they don't know what to do to the specialist they want to engage. So whenever it's necessary, we must be humble to refer the patients to other specialists that know how to treat the patient.
Okay, and from a clinical perspective, and in base of what you do, what you had told now, which aspects of QMR technology appear most interesting in the management of pain modulation, inflammation control, and tissue recovery?
What makes QMR so compelling is that the tissue is genuinely regenerated, not merely recovered. So we have fewer lapses and a healthier tissue.
And which categories of patients may benefit from an integrated therapeutic approach supported by QMR technology?
So QMR technology has very few contraindications. So when we work with patients, we have a lot of accessories, and with the protocols that we have, and also later with some creativity, we are able to treat a lot of patients because QMR is suitable for almost every kind of patient.
Both female and male?
Sorry?
Both female and male?
Both female and male.
Okay. Do you believe technologies such as QMR could contribute to redefining pelvic medicine toward a more regenerative, tissue-oriented, and multidisciplinary model?
Yes, absolutely. I use it as a tool, and I use it as a woman myself. I have 2 devices. I bought the first one in 2022, the second one in 2024 for my own postpartum, and I think it's just something a clinician must have. It's a must-have.
And if you want to give them a take-home message, what do you do?
Yes, to be humble, of course, when you treat a patient, and that multidisciplinary approach is the key to success in pelvic health. Thank you.
Thank you very much, Alina.
Thank you.